Hello, everyone. So we start this session today. I am Pratibha John, and I'm the Knowledge Management Officer across projects at Japigo India. And we have with us Dr. Kshitij, who's a TB expert from India. I request Dr. Kshitij to give a brief introduction about himself.
Yeah, thank you, Pratibha. Good morning, good afternoon, good evening to everyone joining us. Hello, I'm Dr. Kshitij Khaparde. I serve as the Senior Advisor for Infectious Diseases Programs here at Japaigo, India. As a public health specialist, I have had the opportunity to work across diverse geographies in India, contributing to our collective efforts towards TB elimination. I'm really glad to be part of this conversation. Thank you. Over to you, Pratibha.
Thank you so much, Dr. Kshitij. So today, I'm really looking really forward to unpacking some of these themes with you around TB myths, what we are seeing in communities, and government's role in the same, right? So, first question to you that I have is TB treatment often focuses on medicines, but recovery goes beyond just drugs. How important is nutrition and community support in ensuring successful treatment outcomes for persons with TB, sir?
Yeah, absolutely. And this is very important to understand. And I would say this upfront that TB is not just a medical condition, it has strong nutritional and socioeconomic dimensions. What we often see that patients often experience weight loss, weakness, and reduced immunity, all of which directly affects the recovery, right? So yes, anti-TB medicines are absolutely essential, but adequate nutrition, emotional and social support, and overall a supportive environment is equally critical for better treatment adherence and faster recovery of these people. So this is exactly why the National TB Elimination Program here in India has evolved towards a patient-centric, differentiated care model where treatment is complemented by nutritional and social support interventions. It's not just about treating the disease, it's about supporting the person affected with the disease. Over to you, Pratibha.
So true, sir, so true. But there are so many myths and facts around it, right? Like there are many beliefs around food and TB, for example. One common myth is that persons with TB should eat less or, avoid certain food. Is that true, sir?
So, this is one of the most common misconceptions we've had. Let me be very clear, there is no clinical evidence supporting dietary restriction in TB. In fact, it's the opposite, it's the other way around. Persons with TB need to eat more, not less. They need more nutritious and balanced diets, because TB often leads to significant weight loss and weakness. So adequate intake of proteins, calories, micronutrients become very essential. So what should they do? So persons affected with TB should continue normal home cooked foods, which should be tailored to their cultured preferences and tolerance during the treatment. That means it should include pulses and protein rich foods, milks, eggs, if that is acceptable, and obviously fruits and a lot of vegetables, right? See, the goal is to reverse the weight loss, restore lean strength, right? And support the immune recovery. And I always say this, good nutrition is not optional, it is the core part of TB treatment.
That's so reassuring, sir. That's like for us. But many patients still face financial challenges during treatment. Is there any support system in place to ensure persons with TB can access adequate nutrition while on treatment?
Yes, Pratibha, absolutely. So, ensuring nutritional support is one of the India's strongest intervention in TB care, and it has been structured well in the national program. So, under the Nikshay Poshan Yojana, which literally means nutrition support scheme, where all notified persons with TB receives financial support, wherein monthly financial assistance is provided through direct beneficiary transfers to support their nutritional needs during treatment. Apart from this, in addition, the Pradhan Mantri TB Mukt Bharat Abhiyan, that is Prime Minister's flagship program, it's TV Free India campaign, it brings in powerful community driven approach. Through this initiative, individuals and organizations, I mean, literally anyone within the community can come forward as a Nikshay Mitras. Mitras means friends. So they should come forward to provide nutritional baskets, additional food support, and even psychosocial care. So when you look at it together, we now have a system wherein the government provides structured nutrition support and the community adds a human touch to it. And that combination is what makes TB care truly comprehensive and patient centric.
That's really comprehensive system right there, sir. But as common citizens, people often wonder how can we contribute, right? What can people like me, like all of us, how can we help to end TB?
That's a great question, Pratibha, and it is a very important one because ending TB is not just a government responsibility. It's a Jan Andolan, meaning a people's movement. While the health system provides diagnosis and treatment, community participation is also critical. One of the most impactful ways is to become a Nikshay Mitra, that is, friends of persons affected with TB. That's what Nikshay Mitra means under the Pradhan Mantri TB Mukt Bharat Abhiyan. As a Nikshay Mitra, any individual, group, or an institution can adopt a person with TB or all the persons with TB in a particular geography, right? And provide monthly nutrition support such as food baskets along with emotional encouragement during the treatment. And beyond that, not just TB nutrition support, beyond that, every citizen can promote awareness, encourage people to seek early testing if they have symptoms like persistent cough. They should help in reducing stigma, that is, treat persons with TB with dignity and empathy, support treatment adherence, motivate them to complete their full course of treatment, enable access, help connect patients with the government services. Because sometimes even small actions can make a big difference when taken collectively.
That's so well put, sir. So the message I think is very clear. TB care goes beyond medicines. Nutrition, government support, and community participation all play a vital role in this. Do you agree
Absolutely.
with me, sir?
Yes, yes, absolutely. Let me leave everyone with this. TB is preventable, treatable, and completely curable. But to truly end TB, we need early diagnosis, complete treatment, adequate nutrition, and strong community support. You know, curing TB is science, ending TB is responsibility. And together, as a system and as a society, we can move closer to a TB free India. Thank you.
Thank you so much, sir. We'll just look at the chat box if there are any questions.
Sure.
I think we don't have any questions as such right now, but anyone can reach out to us anytime. We're from Jaipaigo. So we end this session today. Thank you so much, Dr. Shitij. Goodbye,
Thank you.
everyone.
Thank you, everyone.